Hello, everyone. My name is Wändi Bruine de Bruin, and I'm a Provost Professor of Public Policy, Psychology, and Behavioral Science at the University of Southern California. Today, I'll give a short presentation on age differences in risk perceptions and mental health during the COVID-19 pandemic. And before I start, I'd like to thank the funders of our national longitudinal survey that we conducted at the University of Southern California. And they also covered some of my time. And so, as you may know, the percent of the world population over the age of 65 is increasing. This is a pattern that we're seeing in many different countries. And these older people make important decisions about risk that affect their health and well-being, perhaps especially during the COVID-19 pandemic. Now, traditionally, there's been relatively limited attention to age differences in decision-making, because behavioral decision research tended traditionally to focus on situational effects on decision-making rather than individual differences. So behavioral decision research typically studied when people violate normative rules of decision-making, and they didn't focus so much on who violated normative rules of decision-making. Also, decision-making studies have traditionally recruited undergraduate students who just don't seem to vary a lot in terms of age. So when you recruit undergraduate students, you're just not in a position to uncover age differences in decision-making. Now, my first study on individual differences in decision-making was published in 2007 in the Journal of Personality and Social Psychology. This was a project I worked on with Andy Parker and Baruch Fischoff. What we did is we took tasks that were developed in the JDM literature, and then we looked at performance across those decision tasks, and we found that there were moderate correlations, suggesting that perhaps decision-making competence is a skill that underlies performance on all of these decision tasks that our field has been studying. Also, we found that decision-making tasks as developed in the field of JDM are relatively valid, seen in correlations with self-reported decision outcomes as reported on the decision outcome inventory. So that means that people who performed better on decision tasks tended to report less negative outcomes in their lives. Since the publication of this paper, we found that our measure has been translated in many different languages and implemented in many different countries, and currently has more than 1,000 citations on Google Scholar, suggesting that individual differences in decision-making are now studied much more often. So in 2012, we published an analysis of age differences in decision-making across these different decision tasks that we had studied before. And we found that age differences did not consistently appear across decision tasks. So the point of this slide is not necessarily to show you all these different decision tasks. The point of this slide is that we found that for some decision-making tasks, performance decreased with age. On some decision tasks, there was no relationship between performance and age. And on some decision tasks, older adults actually did better than younger adults. And then you also see that we show on this slide correlations between performance on decision tasks and fluid cognitive ability. The main point there is that older adults tended to perform worse on those decision tasks that seem to require more fluid cognitive ability. So generally, older adults tended to perform worse on decision tasks that were more cognitively demanding, perhaps as a result of cognitive aging. Then, of course, that raises the question, what do older adults learn with age that helps them to perform better on some decision tasks? Well, to look at that, we borrowed from the psychology of aging, where it has long been shown that older adults generally report less negative emotions than younger adults. So culturally, we may expect that older adults are sad and lonely, but research on psychology and aging has typically found that it tends to be the younger adults who feel sad and lonely. Older adults actually tend to cope better with losses, including sunk costs, than younger adults. That is, older adults tend to focus on the positive, and younger adults tend to dwell on negative experiences, which then makes them feel even worse and can undermine their decisions about losses. But these insights, these findings, have been criticized by people like Susan Turk-Charles, who have argued that older adults' positive outlook may not persist when there are intense crises, such as, for example, the COVID-19 pandemic. This is why I recently published a paper on age differences in COVID-19 risk perceptions and mental health that we observed in March 2020 when we conducted a national survey in the US. On the bottom of this slide, you see a graph that shows age differences in risk perceptions and age differences in mental health, which generally underscore older adults' positive outlook. So older adults perceived less risk of getting COVID-19 than younger adults in March 2020. Older adults are reflected in the darker colors. Younger adults are the lighter colors. Older adults also perceived less risk of running out of money, and they reported better mental health than younger adults. The only measure where older adults did not seem to have a more positive outlook than younger adults were their perceptions of dying from COVID-19. So older adults thought it was more likely that they would die from COVID-19 than younger adults. And this perhaps reflects the actual statistics of dying from COVID-19. Or perhaps it was informed by that. Now, at the beginning of the pandemic, older adults may have had a more positive outlook than younger adults. But then what happened as the pandemic persisted? So what we did is we conducted a longitudinal national probability-based survey with more than 6,000 participants. We were in the field on 10 March 2020, and then every 2 weeks, participants conducted surveys about COVID-19 risk perceptions and mental health and so on. Our data are publicly available, so you too can analyze this data if you're interested. To learn more about the methodology, I would like to point you to our paper in Survey Research Methods that was led by Ari Kaptein. So the first research question that I want to look at is, do age differences in risk perceptions that we found at the beginning of the pandemic persist throughout the pandemic? We found that this is generally not the case. So here you see that age differences that we found at the beginning of the pandemic did not persist throughout the pandemic for perceptions of the risk of getting infected. So initially, older adults thought that they were less likely to get infected than younger adults, but then throughout 2020, that did not persist. When we looked at age differences in perceptions of dying from COVID-19, this is where older adults were seeing more risk to themselves than younger adults, and that did persist throughout the pandemic. When we look at age differences in perceived risk for running out of money, we see that from the beginning of the pandemic and throughout the pandemic, older adults perceived less risk of running out of money than younger adults. And I should say all of these age differences in risk perceptions held when controlling for demographics, having a job, and having been diagnosed for COVID-19. Let's also look at age differences in mental health. The age differences in mental health that we found at the beginning of the pandemic persisted throughout. So throughout the pandemic, older adults reported less mental health problems than younger adults, much less. And this held even when taken into account age differences in risk perceptions, as well as demographics, having a job, and having been diagnosed with COVID-19. So overall, we conclude that older adults generally did not see less risk than younger adults throughout 2020, except for running out of money. And they actually saw more risk of dying from COVID-19 throughout the pandemic. Yet, older adults reported better mental health throughout the pandemic as compared to younger adults, even when accounting for those risk perceptions, as well as demographics, having a job, and COVID-19 diagnosis. Possibly, this is due to older adults having better coping strategies than younger adults. The psychology of aging suggests that older adults engage less in brooding about negative experiences and focus more on savoring the positive. Now, of course, a major drawback of the data I showed is that we didn't actually measure those coping strategies. So our findings do suggest that mental health interventions are needed throughout the pandemic, perhaps especially for young adults, because this pandemic has been a hard time to be young. Thank you very much for your attention.